thank you so much for inviting us here today to talk to you a little bit about the research we're doing regarding taste dysfunction in head and neck cancer. I'm Lucy, and I'm doing a 2-year research degree under the supervision of Professor Nutting and Professor Harrington, and I'm primarily based at Chelsea site at the Royal Marsden. So, as a bit of background to the project, so we know that head and neck cancers represent 3 to 4% of all cancers, and unfortunately the incidence of head and neck cancers is continuing to rise. So despite a reduction in the number of patients that smoke and drink alcohol, we know that the tumours that are driven by a viral pathogen called HPV are actually on the rise. The good news is outcomes are continuing to improve, so with improved surgical techniques and the use of intensity modulated radiotherapy as well as systemic therapy, so things like chemotherapy, we know outcomes are improving, but that also warns us that we're going to have more patients living longer, potentially with side effects from the treatment that we've delivered. So the kind of side effects that we're talking about, I'm sorry it's not projected particularly well, but along the bottom of this graph are all the different side effects that we ask patients about when they are going through their treatment. So things like problems with salivary flow, pain, appearance, activity levels. And this data was collected from a study that Professor Nutting undertook a few years ago called the Passport Study. And it really highlighted that the first thing that people tend to complain about the most is salivary function, and this was addressed in a larger clinical study by Professor Nutting called Passport. And then the next thing people are concerned about is their swallow dysfunction, and this has recently been addressed in a study called the DARS study, and it's just completed recruitment, and over the next few years we'll get an understanding about whether new techniques can improve long-term swallow function for patients. And then the third thing that's of most interest to me is taste dysfunction, and so we're hoping that with some preliminary research over the next couple of years, we may be able to work towards a similar large study such as Passport and DARS to see if we can actually change the way we deliver treatment and improve taste function for patients. So other papers have actually said that taste dysfunction is reported in up to 3/4 of patients, and I'd say that's probably more in line with the number of patients in our clinics that come through and report problems. And our concern and concern of the dietitians and nutritionists that treat some of our patients is the loss of appetite that this causes. It contributes to weight loss and just overall malnutrition. And then equally, it's also been shown that the knock-on effect of this is an overall negative impact on quality of life. So my research aims over the next couple of years is to try and understand the prevalence and pattern of taste loss that's seen in our patients. We want to particularly pay attention to those patients in whom taste function remains a problem at 6 months after treatment, and compare that with the patients who perhaps haven't had problems with taste function, see if we can work out why. We want to understand a little bit more about the mechanism of injury to taste, and off the back of that, develop strategies to reduce taste loss. So really exciting to say we've opened a clinical study which has taken a lot of preparation, but we're now recruiting patients to 2 cohorts. The first cohort is a group of anybody who's about to start radiotherapy, and we'll invite them to participate, and we'll be measuring their taste function when we first meet them, and then we'll be following them up and repeating these assessments at the end of treatment and in the first year of follow-up. The second cohort is basically open to anybody who has already had their radiotherapy and are 12 months post completion of treatment, and we're interested to collect some taste function data on this group of patients as well, with the assumption that they had normal function prior to having their treatment. And we're going to be collecting lots of interesting data. That I'm going to be doing some interviews. That's me in the corner taking an interview. Patients will be filling in a couple of surveys that we're testing out. I'll be doing some smell function tests and taste function tests using some kit, sort of just in those pictures there. And then as a bit of extra sort of exploratory analysis, we're going to be taking some photographs of patients' tongues. This is actually my tongue. You stain it blue with a little bit of food colouring, and take a really high resolution photograph of the tongue. And then from that you can calculate the density of the taste buds, and we may see that over time and with different doses that changes. So that should be interesting. So in terms of how we're going to apply this research, the idea is that we can identify a target, and it's likely to be the tongue, we don't know, but we assume that if we can identify the tongue or a proportion of the tongue that needs to be protected from radiation, so kept within a certain dose, we hope that we can then go on and test that in a study and see if we can prevent taste dysfunction for our patients. And that's it. So yeah, thank you very much for supporting our research.